Today we're gonna talk about oral candidal infection in the oral cavity. It comes in three forms: pseudomembranous candidiosis, erythematous candidiasis, and candidal leukoplakia. Here you can see an acute pseudomembranous candidiosis. It is thrush and it is white patched, creamy and soft, and it can be wiped off, leaving erythematous base and bleeding. Okay, now where we can find it, on the tongue, on the palate, and buccal mucosa are most frequently affected. Angular cheilitis is often found. As I said, it can be wiped off. Distal spread may occur due to underlying genetic defect, endocrine deficiency, or malignancy. And by distal spread, I mean other site other than oral mucosa. Okay, now what causes it? It is caused by Candida albicans. It is already there in the oral cavity, and it is an opportunistic, which means it should increase in number to cause this disease. So it needs a precipitating factor like smoking in the smokers, and wide spectrum antibiotic, steroidal drugs, and any immunosuppressive drugs. These drugs lower the immunity, which increase in the Candida albicans numbers. Also chemotherapy, radiation, and xerostomia, leukemia, and AIDS, and malnutrition, diabetes mellitus, and also it can occur in neonates. Now, how to diagnose it? By taking a smear, and this smear is stained by a gram stain or pus stain, or a culture swab, and this culture swab will put in saproids medium. Or, like I said, this lesion could be wiped off and leaving an erythematous base and bleeding. Now, what is the treatment? I would say treat the underlying disease that caused this candida. Like if the patient have bad oral hygiene, treat it, or have uncontrolled diabetes mellitus, we should control the underlying disease, or etc. Now, if we wanna give a medication, we would give a topical antifungal such as nystatin, comes in suspension or lozenge. For the resistant case, which couldn't be treated topically, we would give systematic antifungal such as fluconazole. Miconazole oral gel is given for the angular cheilitis. Now this picture represents the thrush, which is pseudomembranous candidiosis. To be mentioned, this lesion causes only mild pain. Now we're gonna talk about the second type, which is erythematous candidiosis. It comes in two types, acute and chronic. The acute one called acute atrophic candidiasis because there will be atrophy in the lingual papilla. Or the other name is antibiotic sore mouth because the cause will be antibiotic. Wide spectrum specifically. And now it is common in patient taking broad spectrum antibiotic, as I said, and manifested as erythema. This erythema would be on the tongue, on the dorsal surface of the tongue, or the palate or the buccal mucosa. The patient will feel excessive burning sensation. Now, the chronic erythematous candidiosis, the other names is chronic atrophic candidiosis because there will be atrophy also, and denture stomatitis because the cause here is denture. Now, not any denture. The patient should be wearing ill-fitting denture, and this ill-fitting denture for a prolonged time causing trauma, and the saliva will be under this denture, which will cause this candidal infection, or the patient simply wear this denture during sleeping, which indicates a bad oral hygiene type or style of this patient, leaving the candida to cause this erythematous candidiosis. The lesion here is not sore because it is chronic. As we said, angular cheilitis or stomatitis may also be present. Now, what caused this erythematous candidiosis? Also the same species, Candida albicans. But the precipitating factor here, poor oral or denture hygiene, xerostomia, diabetes mellitus, carbohydrate-rich diets, iron or vitamin deficiency like B12, and steroidal drugs, and HIV infection, and smoker. As you can see, fully edentulous patient, and this is a denture stomatitis. Now, the third type, which is candidal leukoplakia. This type, this lesion won't be wiped off, and commonly occur bilaterally in the commissure of the mouth. It is also caused by the same species, which is Candida albicans. Now, let's talk about a case report. This case report include a human deficiency virus induced oral candidiasis. Now, a 39 years old male came to the oral medicine department and radiology. The chief complaint is burning sensation throughout the oral cavity for the past 1 year. The lesion was mild in intensity, but then gradually there is increasing in the pain. Now, the relevant history is smoking 8 to 10 cigarettes for the past 15 years, also alcohol consumption 90 whatever, and he also revealed about sexual contact with multiple partners for the past 8 years. Upon intraoral examination, there was multiple raised white patch and interspread areas of erythema in multiple sites in the oral cavity. The lesions was on the palate and the tongue, and also in the upper and lower labial and alveolar mucosa and the floor of the mouth. The area was mildly tender, and the white patch could be scrubbable and leaving raw area behind. Now, the provisional diagnosis was erythematous candidiosis, and by provisional, which means pneumonia, it needs further investigations. Now, what is meant by HIV? It is a human immunodeficiency virus, so it is a viral infection. This virus invades T cells, and this virus rupture these cells, so we encounter a low T cells count in these patients. And the oral health status is extremely important parameter for HIV individual because it reveals the immune status. Also, in HIV patient, oral manifestation are the most important and the earliest indicator, which means the dentist could be the first one to know or diagnose this patient as an HIV patient or AIDS patient. There is internationally identified and accepted 7 cardinal signs of HIV infection. These signs are oral candidiasis, hairy leukoplakia, Kaposi sarcoma, linear gingival erythema, necrotizing ulcerative gingivitis, necrotizing ulcerative periodontitis, and non-Hodgkin lymphoma. And the features, the 7 cardinal signs are seen in 50 of patients with HIV infection and 80% in patients with AIDS. What is the difference between HIV and AIDS? HIV patients have the viral infection, but yet the cell counts and the T cells count is not below than 200 cells per millimeter cube. And the AIDS patient, the T cell count is very low, and it is less than 200. Okay, now the most common form of candida occur in fully blown AIDS patient is pseudomembranous candidiosis. But in HIV patient, the most common is erythematous candidiosis, which is in our case. The patient came to the department only complaining from burning sensation. He wasn't in full-blown AIDS situation, so the provisional diagnosis was erythematous candidiosis. Then they talk about what is erythematous candidiosis, and it is most missed and misdiagnosed oral feature of HIV. It is a red lesion which is flat and on the dorsal aspect of the tongue, as we said, also in the hard or soft palate. If the lesion on the tongue is also on the opposing part of palate, it is called a kissing lesion. Now the symptoms, it's burning sensation, especially when the patient eat hot and spicy and salty foods and drinking acid beverages. بعدين بحكوا كيف انه بنشخص, as I said before, smear or biopsy. Also here they mention staining with periodic acid skiff. Now they was mentioning about how each type of candida could be detected. We already mentioned that in the earlier in the presentation. Now what is the management? It is necessary to manage these patients because they are in a situation that would become fatal. So instead of let them die, we could manage their situation and make it a chronic illness. So talking about candida infection, if it is mild or moderate, we give them nystatin oral suspension. But if it's severe, we would give them systemic drug fluconazole. هلا لو في patients having resistant fluconazole resistant, يعني بنعطيهم fluconazole but there is a resistance from this candida, we give them the alternative therapy, which is itraconazole or voriconazole. بعدين بحكوا انه لازم نعطيهم similarly with their original drug of the HIV, which is highly active antiretroviral therapy heart. يعني لازم بعطوهم الهارت the drugs of HIV infection combined with the antifungal drugs. فبحكوا انه مع الهارت ما كان في عنا only significant decrease in this candida infection, also other oral manifestation بتخف وبتحسن مع الإدراك تاع ال HIV. In conclusion, as we said, the earliest manifestation of HIV infection is oral candidiasis, so it is very important to diagnose it.